The earliest form of medical services in Nigeria was introduced by various European explorers, but this was not accessible by the locals until the coming of the church missionaries with the establishment of a dispensary in Obosi in 1880.
Before independence, well, you can't compare that with now. Then the pressure was not, the population is not the way it is now. Pressure was not on our resources as much. We had a lot of these missionaries, who had hospitals, the Catholic mission, the Baptist, the Anglican mission supporting government. But now the population is growing at a very high rate, about 3% annually, and that's huge. And our resources are really dwindling.
In 1960, there was a strong focus on health systems development. Policy makers and political actors made efforts to establish and expand healthcare infrastructures, with more emphasis placed in curative medicine rather than preventive medicine.
Talking about infrastructure, there are quite a lot of decadence or a decay in infrastructures that we have post-independence, and acquiring the newer technology come at a cost.
In 1986, Professor Olikoye Ransom Kuti was appointed the Minister of Health. He adopted the primary health care in 52 local government areas. The giant strides he made in the health sector was, however, halted by the military takeover in 1993. 62 years after Nigeria gained independence, healthcare delivery is still bedeviled with inadequacies, and majority of the populace lack access to quality healthcare services.
What we have in Nigeria now, we have all our systems overboarded because we have lacked proper direction on how this healthcare system should flow. It's from primary healthcare to secondary healthcare, then tertiary. But now we have knocked out the primary. People are now focusing on the tertiary.
Human resource is another body that has affected us after 62 years of independence. Those days we used to have ratio of doctor to patient, maybe ratio 1 to 100. Now we're having ratio 1 to 5,000. That is a big body.
The other problem that could be responsible for poor care is, of course, has to do with the attitude of the people. People are still finding it difficult to trust government, particularly, and this has reflected on our universal health coverage.
Over the past 6 decades, there has been numerous health policies both in the primary and secondary healthcare delivery. However, it is difficult to understand why these policies has not succeeded.
Beautiful policies are being rolled out, but as you know, the challenges in Nigeria, they are multifactorial. Poverty issues there, literacy issues there, political issues are there, and safety issues are there. And all these are things that have been fighting against, us seeing these policies come to reality.
To have a sustainable healthcare service, stakeholders are advocating for a workable plan which will significantly constitute progress in the sector.
As a nation, we must have healthcare indices, healthcare metrics that we must use to measure the impact of and the outcome of our primary healthcare system, because people that have malaria, they have typhoid, they want to have children, shouldn't be bothering people at the secondary institution or tertiary institution. They should have primary healthcare properly sorted, where they can take their deliveries, they can take their immunization, and it is community driven. Everybody in the community is part of the process of primary healthcare.
Although some modest gains and improvements have been recorded over the years, maternal and child mortality, immunization coverage, access to basic health services, and life expectancy remains poor. Nigeria still needs to strengthen its health system.